morning, everyone.
Morning, Brad. Morning, Bill.
Great.
Looks like we are recording and it is 11:01, so I'm going to call the meeting to order. I'll remind everyone to please disclose of any pecuniary interest. And seeing none, we'll move on to 3, which is the Medical Officer of Health COVID-19 update. Hi, Dr. Renaday. Welcome to Committee PM. I'm going to turn the floor over to you. I'll probably ask you to turn your volume up because I don't hear you.
Hang on 1 second.
We do this every time with him.
Yeah. It's a tradition, you know.
It's part of your stick.
Yeah.
This is a recording.
Oh, sorry.
No, I think we can hear you now.
Okay, how's that? Yeah?
That's perfect. Thank you.
Great. Okay, thank you. Good morning, everyone. It's the PM committee, but it's morning. So I'm happy to give a brief update and then turn it back over to you folks for questions. So we've had 2 more cases in the last 24 hours, so that brings our number up to 278 in total. We've had 25 deaths, unfortunately, but that number has been holding stable. We have had 3 more recoveries in the last 24 hours, so we're at 238. And 1 active institutional outbreak that if there are no more cases in the next few days, we should be able to declare over by the end of the week. Other things that you'll note are that this Friday, the province has moved Lambton County forward into stage 2, so more businesses and things can reopen, personal service settings, etc. And so we're fielding lots of questions from those people who can open about what are the guidance documents, how should they be interpreted, things like that. We try to do our best with all of that, and where there are some really difficult ones or ones that we're really not sure or want some provincial clarification on, then we direct those back to the province for further clarification. But you can imagine that with all of these different sectors and stakeholders, there are lots of questions, and so we're continually fielding those. And obviously, if you get them, feel free to send them our way as well. Other things, probably it's important for you to know that in the AM committee, we discussed sending a letter to the province just to say, it would be really helpful to have a public disclosure of the criteria that are used in order to decide whether people are moving from stage 1 to stage 2 or stage 2 to stage 3. And I think that was supported, but the warden might have more comments on that and what the next steps are, but I just wanted to flag it for your attention. And other than that, we're really this is an important move forward, right? We know that a lot of places have to move forward. We know that this 3 months has been very hard on people and that it's important to bring back a bunch of things that people can do and get the economy going again. All of those things are very, very important. It's also important to know that we will remain watchful. And so, at least for, our time frame is at least sort of 2 weeks out from any massive change in in social networks and things like that. We will be looking for spikes in cases. And if they come, we would just say we anticipated that. I mean, we know that is going to happen, and we will follow up on positive cases accordingly as we have been doing from the beginning. So I'll leave it there.
Are there any questions for Dr. Renaday? Councillor Stark?
Dr. Renaday, I've had several questions asking how to define the 10-person limit. Does that involve a number of households? Does it involve 2 households? When you bring the 10 people together, does it involve being indoors or outdoors?
Sure. So you can send all of those folks to us and we can help answer their questions. But for your information, there are 2 groups that we're talking about. So I want to separate them very clearly, right? So the first group is gatherings, right? And so gatherings are now expanded from 5 people to 10 people. People who attend gatherings are expected to continue to maintain physical distance. So now I'm going to move over here and talk about the bubble. The bubble or the circle or whatever you want to call it is the group of people with whom you no longer have to maintain physical distance. So you can hug them, you can hang out with them, you can be close with them. And it's actually any 10 people. There's no requirement that it be a specific number of households, but it's 10 people that you have all kind of within that circle or bubble agreed that you're willing to participate in it, that you're not going to be a part of other bubbles, and that you're going to those are the people that you are basically allowing yourself to be closer to. I think it's going to be that's a really sort of non-enforceable proposition. So it becomes using your best guess. And let's say that there's a family, two families, or three families, and they end up being 11 people. Like, are you really going to say no to that one? No, you're not going to do that, right? Use your best judgment and have it be around 10 people that you're now saying, okay, we can relax our physical distancing rules around those folks, hug them, hang out with them closely as we would normally.
Thank you. That's very helpful.
Councillor Bucci, you have a question? You are on mute right now, just so you know. I can't hear
Doctor,
you.
and every time we ask him for a question, he says, "Go and see your own doctor in Sarnia. He has your file. He would know more about it than I do. He lives in Barrie." The question I have for you, doctor, is a difficult one. I know you have an access to some files, the people who are dying, their sons and daughters coming from hundreds and hundreds of miles just to go in and say, touch their hand and say, "We love you and God bless," and they leave. They're doing, I know that's against the law maybe, but they know they have done everything possible, but is there a possibility on compassionate ground that they could go for a second? Is there a way around it? I know that the bylaws, the laws and everything. Is there a way that it can be done?
So, sorry, Councillor, I missed the first section of your question, but I'm just going to take from what I heard from what you said. And I think it's not a difficult question at all. For me, there is no reason not to deny people basic humanity in terms of visiting people when they are dying. And so I think that most facilities, including our hospital, have had procedures in place to accommodate visiting for people who are imminently palliative, okay? People who are imminently dying. How that takes place is different for different facilities, but I'm I'm pretty confident that most facilities have had rules in place to allow exceptions to the visiting requirements for these special situations like palliative patients. So that is in place. It just depends on the facility what their specific rules are. But I'm not aware of anybody who's been denying visits to in those circumstances.
Thank you.
Thank you for that question, Councillor Bucci. The only thing more tragic than someone dying is someone dying alone. So I think it's very important to make sure that people have that right. Is there any other questions for Dr. Renaday today? Seeing none, we thank you for your update, Dr. Renaday, as always, and we will see you again on Friday.
Okay, thank you. Bye.
Thank you. All right, so we are going to move on to the official part of the meeting. We're going to start with the long-term care division. We have 2 information reports. Can I get a motion to put those reports on the floor? Moved by Councillor Arnold, seconded by Councillor Hand. All in favor? Oh, and we'll discuss those. I'm going to let Jane discuss those reports and highlight anything from those that she'd like, and then we'll open up for questions.
Thank you, Chair Jackie. Just a couple of additions to the COVID report is since I wrote the report, there's also a mission hat being struck by the province to look into the challenges in long-term care during COVID. And also, I believe that the number of homes in outbreak is down to 63. And we also will be open to outdoor visits starting tomorrow. We've got that plan all in place.
Fantastic. I wanted to comment on the testing and what you have been doing so far and how impressed I was to see that we've had 3 outbreaks and none of them have resulted in a institution-wide. It's incredibly impressive for you and your staff. Please pass our thanks on to them. To have one person with it and not to spread it is fantastic. It's exactly what we're looking for. So Any questions for Jane on that report? Mayor Hand, please.
Ms. Joris, is the outdoor visit different than the visiting in the homes where you have to do the testing every 2 weeks?
No, that's what it is.
Oh,
So,
it's part of that.
yeah.
Okay,
So
sorry.
we're still doing window visits and virtual visits, but the guidelines from the ministry for the outdoor visits are social distancing in place, the visitor wearing a non-medical mask, and they have to have had a negative result within the past 2 weeks.
Councillor Stark?
Thank you.
Jane, in your report, page 11 actually of your report, you indicate that if we fall below the 97% threshold for full funding due to COVID-19, considering that we have a waiting list for the residents, and I believe we're now currently below the 97%, are you concerned with the growing sentiment of various people across the province who want to remove their elderly parents from long-term care facilities, particularly in light of the recent report from the National Armed Forces who were brought in to help in 5 different facilities? Are you concerned that even though we have a waiting list, that potentially we would have a hard time getting to the 97% threshold?
I'm not particularly concerned about that. We have had twice that I'm aware of since March 13th where we've had families approach us to take their family member home. One person did go home for a week and then came back, and the other person decided not to. We were provided with some tools from the Family Council and Resident Council organizations on how to assess whether or not someone could be cared for at home. And what we've done is when a family brings that concern forward, we have a care plan meeting with the family, explain to them the care requirements of the person, and help them look into whether or not they will be able to get enough home care to safely care for that person at home. I don't think that I'm making kind of a personal judgment here, and I don't like to do that, but I think there comes a point when people have care needs that require something that we do. I hope that the home care system is going to be beefed up as well with these reviews, but I'm not convinced of that.
Councillor, follow-up, Councillor Stark?
Yes, Jane. First of all, I believe, and I speak from some personal experience as it relates to an elderly parent who moved through that process whereby she needed this additional care to the point where she could not be taken out of the home even for a family dinner. So I hear your point that there are certain issues that just can't be dealt with at a personal level. Having said that, I have to compliment you on the fact, and this goes to Councillor Hand's point, that your care has been phenomenal. Quite frankly, we should be so proud of what you've done in terms of you and your team, to the point where you previously, in previous council meetings, you bore the brunt of criticism that, quite frankly, has been unfounded. And that criticism speaks to the fact that it's just the opposite of what you and your team are doing. So I want you to be conscious of the fact that not all members of County Council feel that you're not doing a good job. On the contrary, you're doing a splendid job. And I want you to take that message back to your people that we're very proud of what you're doing.
Thank you. I'll be happy to do that. I would like to comment, though, that we do have, the word splendid is lovely. We do have a splendid team. We do work in an under-resourced, undervalued, and over-regulated sector. And so it is challenging, and there are gaps, and we don't do everything perfectly, but I think we try our best. And um, what really makes the difference is the support that we receive from the county. You guys know what the budget says, so we have resources that everybody doesn't have. One of those resources has been our infection control practitioners in each home, and I think that that's been um, a huge benefit to us to be able to manage through this really difficult time. So I will pass that on. Thank you. I appreciate that.
Thank you. Is there any other questions or comments for Ms. Joris on either of those reports? Warden Weber.
Yes, I want to echo what Councillor Stark has said. It is really disappointing to hear when we talk what's happened in some of the homes that the military has had to come in. That is just devastating. And to have people in our community that are painting all homes with the same brush is really unfair. And what's happening in our homes, our record shows our staff are doing a fantastic job. So I want to echo that we are not even, shouldn't be talking about that in the same sentence of what's going on with our homes here in Lambton County. So it's unfortunate that happens, but we certainly do support what you're doing, and kudos to all the staff that are working, as you said, in underfunded, overregulated, and it's misinformation that people have of perceptions from some. So kudos and keep up the good work. Thank you.
Thank you. If one thing COVID-19 has shown us is that there is a gap that we need to start filling. I'm wondering, we haven't been doing the day programs, and I know there were a lot of seniors who were relying on those programs, and their caregivers rely on those programs every day to give them a break from that. Is there any chance that those programs will start opening up, or that something can happen with that soon?
Yes, thank you. We are working on a plan for that now that 10 people can get together. We still feel pretty strongly that because our day programs are part of the home, that we need to be very cautious about how we do that. Also at Marshall Golden Manor, our isolation unit is set up in the day program area. So we're thinking through how we're going to manage that. I was in contact with some municipalities this week who their day programs are looking at offering one-to-one support for maybe an hour or so that people can come in. So we've secured some PPE. We've done some planning about how the programs would look, and at this point we're kind of focused on getting the visits up and going, but at the same time we're working on the adult day programs. The virtual day program, thank goodness we got that going when we did, is operating 6 days a week, and they're doing 6 to 8 programs a day. So people are taking advantage of that, but you're right, it doesn't provide the same respite for folks as coming to the day program, but we are looking at how we can get that going again.
I know our home care system is really struggling under these new circumstances as well, so the more support they can get, the better, I think. Even if it could be off-site, because I agree with you, it's difficult. You don't want to bring anybody into the homes for sure, but there's definitely a need out in the community for seniors who are alone, so, or even with caregivers who are struggling as well. So, any other questions for Ms. Joris? Seeing none, we will receive and file those reports. All in favor? And that's carried. Thank you so much, Jane, for all you do. We'll see you soon. And we will move on to Corporate Services Division. We have an information report there. We just need a motion to put that on the floor. Moved by Councillor Cook, seconded by Councillor Stark. And Stefan, would you like to address anything in that report?
Yes, just quickly want to provide council with a brief update on where we are in terms of operations and the impact of COVID-19. In terms of the next few weeks, what we're doing is preparing a plan for a slow return to normal operations, if I could put it that way, which includes inviting members of the public into our county facilities, typically the public, like the administration building, social services. So we have a draft of our plan. A draft of our plan will be circulated to our joint occupational health and safety committees, some of our union partners, and of course our subgroup on the emergency management control group, and we'll receive their comments, and from there we'll move forward. But we're looking forward to reopening, for instance, the admin building to members of the public. But before we do so, we want to make sure that all of our ducks in a row and our plan is well communicated so that both visitors and members of staff know what's expected of them. So we're moving ahead. We're slowly moving ahead in tandem with sort of the reopening of the province.
Great. Any questions? Must have been a good report. No questions? All in favor of receiving and filing that report then? That's carried. Thank you. There's no other business in that division. So we'll move on to Finance Facilities and Court Services Division. There's an information report. We need a motion to put that on the floor. Moved by Deputy Warden Marriott, seconded by, thank you, Councillor Bushi. And Mr. Placcio, would you like to highlight anything in that report?
Sure. Through the chair, just to let everyone know, we continue with our monthly updates as far as COVID. We're closely monitoring it. The important thing to note in this report is that we're still projecting a balanced position for the county. Some quick facts are that 900 of our 1,200 employees are in the essential service areas, taking care of long-term care, social services, and public health. And despite these services incurring significant additional costs because of the pandemic, we're relying on the provincial funding programs to offset these costs. The other point that I'd like to make is that we have gone through a significant amount of cost containment here at the county. From basically, we would put 126 staff on layoff in our cultural services area. The start of the pandemic, it's now down to about 90, 94, and we're going to slowly bring more on as Mr. Meyer advised Summit County Council earlier on in the AM meeting. There's basically hiring freezes, reduced training, travel costs, you name it. We've been looking at ways in order to contain our costs, and that's definitely a culture that we have here. As far as revenue opportunities, we're looking at that as well. And within our capital plan, we've also made some strong strides as looking at some potential deferrals that could be made, approximately $1.8 million. And we continue to monitor the finances of the county. With that, that's happy to entertain any questions if there are any.
Any questions for that report?
Again, I'd like to make a comment that in the AM committee we had the building reports and all those other reports about the activities at the county, and certainly all the businesses, the planning, the development, plumbing permits, all of that stuff is carried on, and we're fairly close to last year's numbers with permits and everything. So kudos for the staff again that are keeping the business of the county planning and development moving forward, and keeping that comes with the revenue and an expense. But it's all good in the budget. Glad we're going to still looking for a balanced budget. So, and getting the work done in the county as well.
That's a very good point. Thank you, Warden Weber. Anybody else? Seeing none, all in favor of receiving and filing that report? That carried. Thank you very much. Is there any other business before we move on to Social Services Division? Seeing none, we will move on. There are 3 reports. Does council want to move all 3 together or separately? Councillor Arnold, all 3 together. He's motioning that. And do we have a seconder to that? Thank you, Councillor Broad. And, sorry. Valerie, do you have any thing that you want to highlight from any of those reports?
I think I'd just like to highlight, if I could, that Circles program is celebrating 10 years, Circles Lambton and Circles Canada. And as you know, Circles is a wonderful poverty reduction program where leaders and allies work together to assist people in receipt of social assistance become self-sufficient. And in your package with the council report, there's a story of one of our Circles individuals and their trip to self-sufficiency. And I thought that was just a really great diagram on how the program works. So I wanted to highlight that. We will be doing some news articles and press releases on the program. We would have liked, of course, to have a more fulsome celebration, but we weren't able to do that with COVID. We hope maybe by the end of the year we'll be able to do something. And I'd really like to thank council for all of their support for the Circles program.
Thank you for that. It was great to see that those programs are making a difference in people's lives, and it's really nice to be able to read about that and see that she is now getting involved in that program and helping others. So it's just fantastic. Any questions or comments about those reports?
One of the key things that I've seen out of this is the 2.27 million savings to Ontario Work. So again, that is there's a payback for that and the work that the people are doing. So
that's a very good point. I've always believed an ounce of prevention is worth a pound of cure, and that's what these programs are designed to do. So that's fantastic to see that.
If I could just add, it's very hard to capture the additional savings, things like people now in the workforce purchasing things, paying taxes. That I don't have a formula for that, but we know there's additional savings as well. And of course, having children exit poverty and then they're participating in the community as well. So there's more and more savings. We just don't have a good mathematical formula for them. So the 2.6 is the only thing we could really do the hard math on.
But that's a very good point. Generations after generations are going to benefit from these types of programs. So we appreciate that. So any other questions or comments? Seeing none, we'll take a motion. Oh, Mayor Hand.
I was just going to mention, Valerie, maybe you want to make the comments that you made about the CERB program that you talked to us on this city call this morning about the impact of the additional 3 months.
Certainly. Yesterday, the federal government announced that there was going to be an additional, I believe, 2 months of CERB payment.
Oh, 2.
So I think it's 2. I haven't seen the final announcement yet, but that was good news for us, and we're certainly concerned about what will happen with our Ontario Works numbers as the CERB ends, and not everyone, as you know, has returned to work. Some businesses have closed, or they're returning at a reduced capacity, and of course the lack of childcare that will be available. So we are watching our Ontario Works numbers. In the report, you can see a huge increase in March for emergency applications. Not as much for ongoing assistance, but we were worried when CERB ended, would we start to see those numbers go up? So this has sort of bought us a little bit of time. There will be people who won't qualify for CERB, and we'll continue to process those applications. But in the Ontario Works report, you'll note we're doing several initiatives to try and assist people through this. So the CERB will be helpful, and those are federal dollars, so we won't have to manage that.
Thank you, Mayor Hand, for highlighting that. That's good information for the committee to have. Any other questions or comments? Seeing none, all in favor of receiving and filing this report? And that's carried. Thank you very much. Is there any other business for Social Services Division? Seeing none, we need a motion to go in camera. Moved by Councillor Broad, seconded by Councillor Loosely, that we go in camera. for a report to provide an update on the progress of a new lease agreement at Bayside Center, City of Sarnia. And just a reminder to all of our many fans who are watching that we will be coming back into open session, but only to adjourn the meeting. Warden Weaver, do you have a comment?
Just a comment, and I made the comment this morning at the AM committee meeting about the county moving to a stage 2. We are opening up some things, some patios will be available, but we still need to stress and hope that everyone respects the rules of physical distancing, washing your hands. That the COVID has not gone away. We need to still be vigilant on that, but you will be able to get out and enjoy a patio and maybe travel throughout the county and find a spot to have some ice cream. Anyway, thank you, and we'll move into council now. So.
That's a very good point. The last thing we want to do is go backwards on this. So we'll just give our staff a moment to stop the broadcast before we start on our in-camera items. I'm still seeing that we're recording, so.